There's so much going on here at the HIMSS13 annual conference and exhibition. Erin McCann, healthcare IT news editor and part of our HIMSS13 TV team, met up with Steve Lieber, CEO and president of HIMSS. Erin?
Thank you, Dr. Husty. So Steve, we're here in New Orleans at HIMSS13. What can attendees expect this year?
Well, as you know, this is our first time back in New Orleans in 5 years. We're very excited about being here. The conference this year builds off of some themes that we've been developing over the past several years. Meaningful use certainly is the big story in health information technology. The investment that the federal government is making right now is fueling a tremendous amount of growth in the space, but it's also raising a lot of questions in terms of security, privacy, interoperability, health information exchanges. I mean, the issues just keep growing more and more every year. So we're spending a lot of time focused on not only getting ready for and qualifying for meaningful use, but also kind of carrying it to the next step, making sure that we've got the healthcare provider and vendor world really prepared for stage 2, stage 3, because this is the first part of a series of stages to get us to true meaningful use and a safer, better patient delivery system. So meaningful use is certainly big. Mobile health, that's another area we're doing a lot of work in recognizing the evolution of health information technology from a purely stationary, in a facility type of information system to devices that physicians and nurses carry with them everywhere and want to have access to that patient data, applications that consumers are using to manage their own health. So there's a number of issues around mobile health technology that's going to be a part of the conference this year. Clinical intelligence, clinical decision support, the technology tools that help doctors and nurses make better patient care decisions. Big part of what we are focused on as well. Recognizing again, with the presence of better information at the right time, making sure it's on the right patient, the clinician can make better decisions and obviously resulting in better patient outcomes. So I'd say those are the three big ones that I'd highlight.
Now you have a big lineup this year. You have Karl Rove and James Carville, Bill Clinton. Why did you choose these speakers?
Well, you know, the American healthcare system is very much dependent upon what happens in political circles. And so the politics of America very much are a part of the healthcare of America. And so having counterpoints from different political perspectives is a key point in what we try to do with this conference. It's not about bringing one viewpoint into the discussion, but really bringing in all of them. So that's the Carville Rove. We also have Donna Brazil and Mary Madeline, two other commentators from both sides of the political aisle that are speaking at our Health Transformation Project symposium for executives. So we're really very focused on bringing in that policy political side. President Clinton, just someone who has probably shaped the last 15 years of American politics more than anybody else. I mean, including in the last election in terms of his speech nominating President Obama for his second term at the Democratic Convention, really got the base excited. And so, bringing a person like that into the conference brings excitement, brings a different sense to the audience. And so we're very excited about having him. Warner Thomas, who's the CEO of Ochsner Health Systems here in New Orleans and has been at Ochsner for years, going to be telling a story about how that system survived Katrina and has emerged as truly a leading edge, innovative health system using technology. So I think he's got a very clear message that's very relevant to this audience. So we're very excited about this year's lineup.
Now, how many attendees are you expecting this year?
You know, it's a funny thing because you'd think we're standing here just the day before the conference opens when we're filming this, and you'd think we'd know how many are going to be here. This audience keeps coming and coming day of, after we start, so we're still probably a couple of thousand people away from our final number, so it'll be in the neighborhood of 35,000 people.
Okay, thanks, Steve. I appreciate you speaking with us today. I'm Erin McCann on HIMSS13 TV.